Welcome, and thank you for joining me and taking the time to watch this short video on Plan to Achieve Self-Support PASS Plans. My name is Denise Luzak, and I am a program specialist for NYESS, New York Employment Services System. Topics that I'm going to go over during this video, I'm going to go over what is NYESS, why employment is a good idea, plan to achieve self-support, PASS plans, as well as I want to leave you with resources. New York Employment Services System, NYESS. What you're looking at right here is all the state agencies that NYESS partners and collaborates with. When New York State once identified a gap in employment services, NYESS was established to help address that need and create a single point of access for employment-related resources and supports across the state. As I just mentioned, NYESS has a statewide partnership with multiple state agencies, as well as a collaborative employment services case management system. NYESS is a primary employment services data source and a way to connect individuals to local ticket-to-work employment networks. If you or someone you know wants to get connected with the Ticket-to-Work program, please give us a call and we can help you find a local employment network. Ticket to Work is a great program for individuals ages 18 to 64 who are on SSI and or SSDI and would like some additional support when finding a job. So NYESS, our primary focus is being a resource for all things related to employment. Employment is a good idea. So to help normalize the conversation around employment, everyone from leadership to program staff should be equipped with the language, tools, and strategies needed to make employment a standard and primary focus for participants. It's important to consistently communicate that work is beneficial, as well as it's a key social determinant of health. Social determinants of health are the conditions in which people live, learn, work, and play. These factors influence overall health outcomes, including both physical and mental health, and can significantly impact a person's well-being and quality of life. Work also has a positive impact on a person's physical, mental, and financial well-being. Beyond that, employment helps individuals build social connections, engage in meaningful life roles, and develop a sense of self-worth, as well as strengthen a strong work ethic. Overall, work contributes to an improved quality of life. Additionally, research has shown that individuals who are working often require fewer clinical interventions, including services related to mental health and substance use. With that in mind, let's explore some resources that allow individuals with disabilities to maintain Medicaid coverage while working and earning above the traditional income limits. PASS plans. A PASS plan, otherwise known as Plan to Achieve Self-Support, is another work incentive that allows an individual to set aside money other than SSI cash benefits for a specific time period so that individuals can go to work and achieve their work goals without losing their SSI cash benefit. An example of this could be an individual has been taking public transportation to work. And they've been wanting to set aside money to buy a car, but they are worried about going over the $2,000 resource limit, putting them at risk for losing their SSI cash benefits. An individual can create a PASS plan. However, it must be approved through the claim representative at your local SSA office. This allows an individual to set aside money to save to purchase a car so they can go to work and not lose their SSI cash benefit. This will not be counted against them as a resource and allows individuals the ability to save. Some examples of what a PASS plan could cover: childcare, a vehicle, computer, start a business, school expenses, equipment and tools, transportation, uniforms, or other items or services needed to reach an employment goal. Again, past plans provide individuals the ability to save and set money aside so they can achieve their work goals without losing benefits. And just as a reminder, past plans do need to be approved through your local SSA office. Past suspension and termination. A pass will be suspended if any of the following occur. If the plan is abandoned, if conditions of the plan are not followed, and if a medical condition prevents participation. A past plan will be terminated if any of the following occur. So again, a past plan will be terminated if SSI eligibility is terminated, if there are 12 consecutive months that elapse after a pass is suspended without it being resumed, and lastly, a pass will be terminated if the vocational goal is achieved. This page right now is showing you resources that are available. I have listed our website, the New York Employment Services System homepage, NYESS, NYESS.ny.gov, as well as the SSA myths and facts sheet that you can find. And then additional resources on more information for the Plan to Achieve Self-Support PASS. There's also the SSA Red Book. And lastly, a resource on Will I Lose My Medicaid If I Work? Again, thank you for taking the time to watch this short video on PASS plans. Please visit our website for more information and reach out to our team with any questions.